So let us discuss a remedy today from Alan's keynotes in this Alan's keynote study streak. We have been discussing some female remedies that act on, the female reproductive system and the discharges and the menorrhagia, metrorrhagia that they keep having, the pathologies that they keep having. So welcome to this Alan's keynote study streak and good evening, Dr. Ruturaj. I hope you have been attending all sessions and you have been understanding and reading along. If you have Alan's keynotes, you can just read through the pages and you can get to know how beautifully little things are there, short, concise, but practically they are all reproducible and presentable by the patients in the clinic. If you master this book, at least 70-80% of your practice is set. Let us go over today's remedy. Dr. Prasad Kulkarni, namaste on YouTube. So we are live on YouTube and Instagram simultaneously. So far we have discussed some female remedies like Ustilago, Thalaspi bursa pastoris, Trillium pendulum, and today we'll study an interesting remedy which is Sabina. So the first line, and interesting to note that we also discussed this in Thalaspi and other remedies of the female reproductive system, that all the remedies that act on female reproductive system have to act on the joints of their body as well. So if you come across a case of a joint complaint, don't go for a rheumatic remedy. You can keep those rheumatic remedies in mind, but also think of all the female reproductive system acting remedies like Thalaspi bursa pastoris, like Ustilago, like Sabina. The first line in Sabina reads, chronic ailments of women, arthritic pains. This is an eye-opener for everyone to believe that it is not just a female remedy but also a remedy you can use in RA cases, OA cases and routine arthritic pains of females. They will come to you with a strong symptom of the rheumatic complaint, rheumatic spear, and they will tell you that menses are a bit irregular, there is a bit of a back pain, they have fainting, they have vertigo. Think of Trillium in those cases. Only backache and very sad because of the entire disease that has been dragging them. Think of Sabina. So the next line what you read from Alan's keynotes for Sabina, music is intolerable, produces nervousness, goes through the bones and marrow. If it causes weeping, it is thuja. If it just causes them to feel sad, they keep on listening to those old songs, the old Kishore Kumar songs, Mohammad Rafi songs, and feel sad. Think of Sabina very strongly. Or the recent songs which are more in, speaking about sadness rather than being active. Sabina is a remedy that will work for them, especially if they are also depressed, they are not feeling well in the mental sphere along with the arthritic complaints. Next you have is physical generals, and in this the book that I hold is from BJN Publishers, and these latest authors have converted many things, rearranged many things. In the old classical textbooks, it is in another form written by Alan himself. So whichever book you read, the idea is to impart knowledge. The idea is to take this wonderful book ahead and spread to as much as people, whether you are a beginner, whether you are a professional. This is going to be the base of your practice. It's giving you a lot of physical generals. Like in Sabina, we have drawing pains in the small of the back, the lower back, lumbar region or the sacral region, from the sacrum to the pubes. So it comes from the back and it comes to the front, and it kind of holds them down and doesn't let them move or doesn't let them work freely as they are usually doing them. These are the pelvic bones These are the area where the entire energy of the Sabina remedy and the patient is concentrated. If they constantly complain about some ailments over there, Sabina is the remedy. Another differential remedy we should think of in our mind is Sepia. So, in nearly all diseases, drawing pain, something that is pulling them back, if it is pulling them down, it is Lilium tigrinum and Sepia. If it is pulling them back, it is Sabina. From sacrum to the pubes in nearly all diseases, and if it is viburnum opulus that you need to prescribe, you will see that it is from the back and it goes towards the entire body. Now there will be patients who will report to you with lots and lots of miscarriage related ailments in their past history. They have now come to you with arthritic complaints. They have now come to you with irregular menses. We think of constitutional remedies, we think of chronic remedies to treat them. But the fact is that Sabina can be equally competing with the constitutional treatments, with the chronic treatments, if you know how to use them. Figure this out. A patient lands in your clinic with pains in the small joints, in the legs, in the hands. Periods are irregular. There is a back pain which kind of makes her uneasy. She's a bit sad, and she says that she had a history of abortion in the one of her ages few years back. That is the recipe to prescribe Sabina. Tendency to miscarriages, especially at third month. Ailments following labor or premature labor or abortion. Hemorrhage from the uterus, flow which is partly red, partly clotted. Worse from the least motion, often relieved by walking, pain extending from sacrum to pubes. So you have a perfect case of Sabina presenting in front of you with complaints that there is the hemorrhage which has never ceased since the last abortion miscarriage. It is intermittently going on. Since that time I have this issue and it is dragging me, it is not making me feel at ease. Feels better when there is some motion done. We always tend to prescribe Rustox for better by motion. The back pain, if it is more pronounced, ailments from abortion or miscarriage is there, then think no further than Sabina. Don't go for Rustox because it's going to just palliate the case and you will end up giving up Rustox, and then again and again the cycle will repeat. They lose hope, they land up in the hands of gynecologists. Now you have the nature of menses in Sabina. Too early, too profuse, too protracted, partly fluid, partly clotted. We saw this also in Ferrum Metallicum in persons who menstruate very early in life. Nowadays there is a very strong presence of hormonal surges in female, especially the girls. Even at the age of 10 or 12 they are getting the menses. Sabina can be a remedy for them later in their life. Right now they may require pulse, calcarea, even calcarea phos, but in the later stages of their life, when they come to you with other complaints, you can think of Sabina, because this is a remedy which you should employ in cases where early menstruation has started and labor like pains or colic is there. Pain from sacrum to pubis is very strongly present. There will be joint pains slowly when they will report to you in their 25s or 30s. Discharge of blood between periods with sexual excitement, umbra grigia is another remedy. Retained placenta from autonomy of uterus, intense after pains, colophyllum and cecal cord. Now how will you find this symptom? It's very interesting. Many patients that will report to you with complaints that a miscarriage happened. I visited a gynecologist and the gynec did some dilatation and curettage, and now I am off to my work. Daily routine is going on, but there is still the bleeding which kind of oozes out on a daily basis. It's been 15-20 days, but I'm still not at ease, doctor. If this is the expression of the patient, it is somewhere the retained placenta or the uterus has been atonic to not let the contents expel fully, that should be your area for prescribing Sabina as a very strong remedy. You will need to give it on a repeated basis, twice a day, thrice a day, maybe even 4 times a day, 200 or 1 m potency for 10-15 days. You will definitely see the result. The idea is to set the uterus in a good physiological state which it was earlier, before the disease, before the state of miscarriage, so that in future it doesn't disturb or harm the economy of the body as a whole. Otherwise what you need to do is, if it is at all not given, the Sabina as a remedy is not given during the miscarriage state, after the miscarriage state, the patient somehow takes some other medicine, does some home remedies and drags on, and this complaint goes off somehow. But when they report to you in their 40s and 50s with complaints of all systemic disorders, but at one point of time there was miscarriage, there was this abortion which dragged them for a few days by the bleeding which kept on oozing, Sabina as an intercurrent needs to be given with your constitutional remedy that will give the tonicity to the uterus. You have to understand this. Only constitutional will not set things right. You need to also set the organs in motion, with the entire body in motion from the constitutional point of view also. Then it is that you will see the result, which kind of Sabina will clear like a block. It will work as an intermittent remedy. Antimiasmatic or intermittent remedies are not something that we give as sulfur, meadow, thuja, syphilinum, but it can also be these remedies which have their seat of action in certain organs, and they kind of give the organ the equilibrium that is needed when they were in their pre-disease state. Keep this in mind, and if you have experienced this, or probably this is a good tip, do mention in the comments of my video so that I know it has helped you. Next you see is menorrhagia during climacteric in women who formerly aborted with first early menses. So actually the entire story which we have been reading so far actually matches exactly what is mentioned over here. Patients will report to you in your climacteric age. They will tell you that I had my first menses very soon, and what happened was I had a miscarriage also after my marriage, and then I developed these complaints. Doctor, please give me some medicine. That is where you should think that the patient also has complaints currently of menorrhagia at her 40-45 years of age. Then you should think of Sabina as a remedy. Think no further than this remedy. It is going to be a miracle for you. It will give you many patients more than what the gynaec sees. Next you have is inflammation of ovaries or uterus after abortion or premature labor. Very well. Many cases who have had their first pregnancy, they kind of land into second pregnancy by chance, not by choice. They go into miscarriage or abort it, but after that PCOD develops. The ground for Sabina is set. Give this medicine and things are going to be alright very soon, and they may even get good chances for conceiving by choice in future if they opt for. We tend to give constitutional medicines, but we never realize that these blocks need to be cleared. Unless these blocks are cleared, your constitutional medicine is just going to go tangentially and it is not going to hit the bullseye, and that is what will demoralize you, demotivate you, and make you lose your faith in homeopathy. So these small medicines, the ailment from in each cases, if you try to figure out, give the medicines as a block removal for those phases, it is going to push your cases forward, push your patients towards cure in the long run. Next you have for Sabina is promotes expulsion of moles, foreign bodies from the uterus, which is what has happened in so far history of the case. There is some part which has remained and caused a lot of destruction in the uterus, or it is causing a lot of swellings, fibroids, etc. etc. Same is the case with cantheris. You can employ that also if the conditions are meeting perfectly well. So that was about the female reproductive system. Next we have is the skin. Fig warts with intolerable itching, burning, exuberant granulations like the remedy thuja and nitric acid. So all those cases where you are giving thuja as an intercurrent remedy in female reproductive system, when they are coming to you, think of Sabina very strongly. Think of all the female remedies, in fact, rather than thinking of thuja, sulfur, medorinum, syphilinum, etc. etc. Think of these female remedies. You need to tone their uterus. That is the concept. You need to take back the energy of the organ back to the pre-disease era. So thuja is a remedy which is very close to Sabina, and you will see that it is also a remedy which belongs to the same family as thuja. So aggravation modalities of Sabina: from least motion like the remedy sickle core, warm air or room aggravate Apis mellifica and pulsatilla. Amelioration from cool, open and fresh air. Now we have the relations, very much complementary to thuja, one of the top remedies which we prescribe in all the antipsychotic cases. Now here's the catch, and when you should prescribe Sabina. So all those cases, especially females, those who have had miscarriages, those who have had issues in their menses, irregular menses, dilatation and curettage done, or cases of PCOD which have developed by ingesting those hormonal pills, that is where Sabina will do the work for you, give you the clarity of what needs to be given after Sabina. When Sabina removes the block, maybe you can go for another remedy, or it may totally cure the case. Now here's another thing that you need to remember. In comparison, for Sabina, the medicine written is Calcarea carp, crocus, millefolium, sickle and trillium. So you will figure a case of Calcarea carp in your clinic, and you will say that yes, Calcarea carp fits my entire totality. You can go ahead and give the Calcarea carp as a medicine. But if you see in the history, there was a very strong elements from miscarriage, elements from first menses, too much bleeding, some visit to gynec, or some hormonal treatment done for delaying the menses. Sabina intercurrently should be given every monthly basis or 15 days, one dose or a few doses for a day or two. Continue the constitutional medicine, and you will see the miracle of both the medicines which work in conjunction with each other, Calcarea carp and Sabina. So this is the way forward for all homeopaths. It is not just one medicine or a single medicine throughout the life of the patient, but tuning into the frequency of the disease as per the need of the hour, and that will be the way we can take this science forward. So you have a complete detail of Sabina. If you like this video, if you got some information from this video, please feel free to comment below, and we'll continue with this Allen's keynote study streak further down the line till we finish 40-50 odd remedies which are left. And thank you all for joining, and see you soon tomorrow again around 5:15 p.m.